Welcome to another episode of The Disruptors, where we're arming you with the tools you need to innovate within the physical therapy space by highlighting those who have come before you. I'm your host, Stephen Cohen. Now, let's get into it. All right, everybody. Welcome back to another episode of The Disruptors, where we're highlighting those that are innovating within the PT world. Today, I am blessed to be joined by Dr. Barton Bishop. Dr. Barton is a managing director at Deloitte, where he works with state Medicaid agencies to improve their operations and intelligently apply analytics to reduce fraud, waste, and abuse in Medicaid spending. Prior to that, he practiced outpatient sports medicine in the DC Metro for 15 years. He is married 20 years, very impressive, has two children, Katerina, 15, a sophomore in high school, and Alex, 12, a seventh grader. And Dr. Barton, welcome to the Disruptors. It is a pleasure to have you.
Thanks so much. Thank you for having me.
Absolutely. Well, let's hop right into it. To get into my first question, what is the why behind PT? Why did you get into it?
Why did I get into it? Great question. So when I was in high school, I have a disabled older brother, and he is a lifetime recipient of Medicaid and social services benefits in the DC or in Nebraska. And so his experience with doctors just through all walks of the medical profession led me to say that when I graduate high school, I'm going to go to a school where I can then push myself to get into some sort of medical field. I toyed around with pharmacy, I toyed around with medicine, and ultimately landed on physical therapy and decided that I couldn't live my professional life away from sports. And so I wanted to go into sports medicine, PT, and that's where I ended up.
So that experience ties a lot of things together now for what you're doing now within Medicaid.
It does.
And so one of the things that we like to highlight here, or the reason I started this show, is I thought there was a lot of content around innovation on the clinical side of physical therapy, but not much highlighting those who are doing different things with their career, different things with the way that they run a business, right? Those pieces. So what was the why behind the transition from treatment into consulting? I'd have to imagine there's a tether there for the Medicaid piece, or at a minimum a tether, right?
Well, no, there's definitely. So I was practiced for 15 years, as you mentioned. For the last 10, I was the chief clinical officer of our multi-location, multidisciplinary physical therapy, chiropractic, fitness, wellness, and research institution in the DC area. So we had 8 clinics, we had 4 business lines. I was responsible for all things operations out of our clinics. About the last 5 years, I did less and less patient treatment, patient management, and more into operations and executive leadership. And I found that very fun, but I also realized that I either wasn't being challenged enough or wasn't challenging myself enough. And I think they're kind of one and the same. And I started to look into other areas to see what else I might want to do. I talked with a bunch of people, talked with Heidi Jananga, who started WebPT, and a good friend of mine, talked with partners at Deloitte that are good friends of mine. And I started to just open up the lens. Did I want to go into larger physical therapy clinic business management? Did I want to go into hospital administration, lobbying, consulting? Like, what did I want to do? And I ultimately found that one of the things I did in my old job was some small business consulting. And I would help product companies, I would help physical therapy clinics, expand their service offering, improve their operations, whatever it may be. And what I realized was that challenge was what I was looking for. And so when I came down to it, I landed at Deloitte, and I didn't land in any of our Medicaid offerings. I actually started in our military health service, where I was helping military health improve their operations and quality of care and service delivery, reduce risk in the way they're doing things. And then I made a pivot into Medicaid just before COVID, like 2019, and really have thrived and loved it ever since, because it has hit home for me to say that what I want to do is I want to improve the way Medicaid is being delivered. I want to improve the way the most vulnerable population among us are receiving care, and also to make sure that they are able to receive that care because we don't have a bunch of fraudulent activity that's happening. But I'm sorry for a long answer, but also I know as a therapist and as a business owner, it's incredibly difficult to bill for and get paid for the services that you need that you're doing. And so
Yep.
I want to help us be more intelligent about what we're doing and not indiscriminate, and help us to be more surgical with how we're finding this potential fraudulent or untoward activity, as opposed to just kind of like a gross, hey, let's just audit 10% of the population and see what we find.
It- there's a tension there, right?
Yeah,
And like anything, it can be on a spectrum in terms of how tight the tension is to one way or the other, and there's pros and cons to both sides. And so I hear you say that, and I think of and I hope I'm okay with saying this. I'll
yeah,
find out later. But in Colorado, right? So we facilitate the remote therapeutic monitoring CPT codes.
yeah,
It's the company that I co-founded does, and the waiver process is so arduous that these groups are like, do we even continue to enroll patients, even though we see the clinical outcomes are getting better, the no-show cancellation rates going down, and it
yeah,
allows us to space out treatment, meaning fewer resources from that individual and or their family are required to get the treatment they need.
yeah.
But I would imagine that that waiver is probably due to having it swung the other way, right? And some folks, whether in a with malintent or not, right, raise some red flags.
Oh, yeah. I mean, stay in Colorado, and this is public news. So, I'm not giving anything away here, but Colorado has had a massive fraud scheme around non-emergent medical transportation. So basically, what you had were companies that were saying they had like a specialized vehicle to help transport people that needed help, and they didn't. They were driving in, a Hyundai Sonata, totally fine, but not a specialized vehicle. They were also picking up multiple people, as many as 9 or 10 at a time, and throwing them in one vehicle and charging for each of those people, which you're not allowed to do. And then they were also even driving around homeless centers, picking up homeless and paying for them to get around and drive in their car. I mean, it's a massive issue that Colorado's still unwinding. So when you think about, like, there's one state and you've got something that can help people and can improve access and quality of care and outcomes, while the state is dealing with something that is designed to help people with quality of care and access, helping them get to their doctor's offices or their dentist or their drug treatment facility, that's creating fraud. The state's now just like, whoa, what do I do? And I'm
Yeah.
not saying Colorado's doing that with the waiver program, but you can imagine why they would. So how do you be more intelligent to prevent that so that the good stuff can get through too?
And I think it's an admirable mission to undertake, and I really appreciate that you and your team are going through with that, and not from a selfish reason, but like as we just see the Medicaid population in particular, and when there's I mean, hate to hit on this, but yeah, transportation insecurity, even housing, food insecurity, right, and
Hmm.
these
Hmm.
things that make it very difficult to like live, much less recover from an injury. It's like, geez, like
Yeah.
it makes me, yeah, sick that folks would
Yeah.
take advantage of that in that nefarious of a way. But I'm glad there are folks like you who are saying, hey, yes, there are bad
Right.
apples. Like we need to design systems to protect against that, so that way the coffers are full to be able to pay for the things that are really, really going to help, and not put those arduous steps in place that are going to titrate treatment in a non clinical or like efficacious way.
Yes.
So
Yeah,
I
agreed.
I appreciate that very much, and let's actually peel the onion back a little bit on
Okay.
consulting. And you said
Yeah.
earlier, sorry for the long-winded answer. Don't be. So the entire goal of this is that someone could listen to this and
Yeah.
get one step closer, or maybe two or three, but setting expectations, right? One step closer
Yeah.
to being able to make a change in their career, or at least feel that much more enabled to make a step. And
Cool.
so you looked at different levels of consulting, and as we talked about
Hmm.
before we started recording, I spent 7 years at Deloitte, right, as analyst,
Yeah.
consultant, senior consultant,
Yep.
manager.
Yep.
I know that, and I made the joke that like a PT with some Excel skills would be absolutely just a game changer for a
Yeah.
lot of
Yeah.
client teams
Yeah.
because of I'm gonna stop myself there and not opine because I want to hear what you have found and then also what you think are some of the skill sets you learned by treating that have directly translated because I know there's a couple in my mind that instantly
Yeah.
come, but I would love to hear your thoughts.
Yeah. Well, so it's funny. So I started at Deloitte 7 years ago. Actually, I think 7 years ago tomorrow. This is October 15th when we're recording.
Happy almost
And
anniversary.
thank you. And I remember going to my first CSM after I had started, and good friends of mine were like, what did PT teach you about consulting? Like, how could you go to consulting? And my answer then is really the same now, which is I think as a physical therapist, we are in a unique position that not many other healthcare professions are. Occupational therapy would be one, chiropractic is another, where we spend a lot of time with people. And we also have to therefore learn how to communicate with people from across the spectrum. We have to learn how to understand what people are telling us and what they're not telling us. And then
Yep.
we have to be able to think rapidly on our feet. And so when you take this into consideration and then you say, well, what is consulting? Well, consulting is effectively that. It is thinking about what our clients are telling us and what they're not telling us. What are their real needs that they can't quite articulate, either because they don't want to or they don't know what they really are? How do we think quickly on our feet when a client asks us a question? How do we engage clients from across the spectrum? Government, commercial, executive, junior, whatever it may be. And so I think that those core physical therapy skills that I had, not treatment skills, not, hey, I can figure out how to, activate your glute because you're having medial knee problems, but the other stuff of it. How do I relate to people? How do I work with people? That is a core foundational skill that physical therapy innately teaches us. So when you then take that and put it into, okay, now what do you want to do in consulting, right? Like how do you, where in consulting do you want to go? What do you want to be? Who, as I say, who do you want to be when you grow up? It kind of depends on what type of firm you want to go to. So
Yep.
if you're looking at a firm like Deloitte, Stephen, you were at Deloitte. Deloitte is the largest professional services firm in the world. To put it in perspective, we in the U.S. have, I don't even know, 220,000, 200,000 employees in the U.S. We do worldwide on the neighborhood of $70 billion a year in revenues. So we are not small, which means that generally speaking, we work with larger entities. And so if your goal at a physical therapy is to say, hey, I've been a physical therapist for 15 years, I really know what I'm doing. And I think all these other physical therapists out here have no clue what they're doing. And I want to help them be better. That's not really a Deloitte thing. But there are many smaller physical consulting firms out there that would be great. So you almost have to decide, what do you want to do? Do you want to be someone like me that rarely uses physical therapy, or my clinical background, my actual clinical background? Or do you want to be someone that uses it every day just in the consulting world, whether you're helping with product development or innovation or business operations? There's a huge spectrum, and you really have to decide in order to make that biggest impact.
I I love it. And, you mentioned there's a couple pieces I want to highlight. One is PTs become geniuses at context,
Mm,
like
mm,
absolute geniuses at context, right? So you mentioned the getting that glute to fire, right? And I
hmm.
imagine, yes, that is the outcome that you want to see, the behavior change that you want to
Hmm.
see, which behavior change and change management are pretty much
The
synonymous, right?
same. Yeah.
Yeah,
Hmm.
one is down to the person level, the other is systemic, but
Hmm.
there's always people involved in
Yeah.
anything, right? And
Yeah. I like
so
that. Yeah.
I think that's where PTs that are listening, like the thing that you probably don't give yourself enough credit for because it's so just rote at this point, right? Where it just feels like just natural muscle memory is you are a genius at context, because
I love it.
two people that present with the exact same thing, you want the exact same outcome, which is a behavior change of getting that glute to fire. If it is a, to use your military, right? If it's a military special operator, it's going to be a very, very different thought process and protocol than a 67-year-old who wants to be better on the pickleball court, right? To an
Yeah.
87-year-old that's in a assisted living facility, right, that you want to see. So all
Hmm.
have the same, protocol, if you will, or even, even down to their home program, right? Like, okay, I want each of
Hmm.
you doing this thing, but
Hmm.
for the special operator, right, it's going to be very different than, and maybe more around like, hey, if you want to be able to get in and move in things where you're crouched down and be able to
Hmm.
be solid, or not be sent back to Germany, right, to get
Yeah.
PT, and you want to stay on the battlefield, that's the mechanism of change versus
Hmm.
the 87-year-old, like, hey, I don't even need you to go to the gym, right? Well, all I want you
Yeah.
to do is like these step ups and think about this
Hmm.
this thing, or even
Yeah.
balancing on one leg, right? Close your
Yeah.
eyes for a little bit. Like, anyway, I'm not
Yeah.
obviously my
Agreed. No,
non-clinician
you're
showing.
speaking like one. Good job.
I like to say my non-clinician shows, especially when I, had to demo and like show documentation and all that. I'm like, yeah,
That's cool.
I'd get
That's
reprimanded
cool.
pretty darn quick.
And my non-core consulting skills show regularly in consulting. So, I mean, I didn't grow up in it. Just like you didn't grow up in physical therapy. And so you have to recognize where your gaps are and then figure out, do you need to fill them or do you want to fill them, or can someone or something else fill them for you?
Oh, there's brilliance in that statement. And I've been lucky enough to be mentored by quite a few people, and luckily one of them who I actually worked at when I was at Deloitte. I don't know if you've ever come across a DICE, if they still call it that, but
Mm.
it's the group that analyzes contracts using that AI tool. We brought
Oh,
them back in 2013. But the
okay.
CEO of that startup we that Deloitte partnered with, when I was starting Sarah Health, I asked him, hey, how do I think about this? Should I start coding and all that? He's like, well,
Hmm.
do you think that you will be able to, with intense focus, be a top 1% developer? Like, what are the chances of success there? I was like,
Hmm.
probably pretty low, right? Like, it's a
Yeah.
pretty small end of the pyramid to get into. And I
Hmm.
don't know if I have some innate talent, have the work
Hmm.
ethic, but I don't know if I have the innate talent
Yeah.
to get there. And
Yeah.
so I chose to supplement that by finding a co-founder. So I
Good.
think there's a lot of brilliance in that statement, in that you don't have to be the perfect consultant, which by the way doesn't exist, right?
No.
Just knowing, hey, I'm really good and passionate about these things, and then these are going to be gaps that I'm going to have to find an organization that I either fit into or can hire to be able to supplement. So I think that
Yeah.
there's already a couple really, really good pieces of insight that are coming out, in which I like to restate just to make sure everyone gets it. One is finding where you think you should land based on what you want to do, right? I think you laid it out
Hmm.
really, really well. Like, hey, if you want to be in PT still, like,
There's a
probably your
bunch of them.
Deloittes, your
Yeah.
Accentures, your
Yeah.
E&Ys, right? Your
Yeah.
BCGs, Bain,
Hmm.
probably not going to do much there, right?
Hmm.
Outside of maybe having some hospital clients that can, to your point, afford the fees
Yeah.
that these large groups have. And even then, the likelihood you're going to be working much with the rehab group is probably
No.
pretty good.
No, you're
Right?
doing EMR implementations.
Yep.
You're doing revenue cycle management. I mean, like truly, that's what you're doing if you're gonna go to hospital groups like that. Yes.
Yeah. And maybe there's some digital transformation in there that might touch some
Yeah.
rehab group,
Sure.
right, outside of the EMR, but that's a
Yeah.
maybe, right?
Hmm.
And niching down isn't necessarily a bad thing either, right? If you came
No.
to a Deloitte like, hey, I think there's a whole business here to be made by consulting with large health systems to be able to optimize their rehab group, and like, here's how I think you could do that.
Hmm. Yeah.
I know a lot of partners, including probably yourself, that would happily take that
Yes.
call.
Yeah. Absolutely. And it's funny because I think I think you can create a business case for anything, and no one's going to really shut you down, really anywhere you go. It's a matter of have you proven it out, and do you have the runway to be able to make it happen? Whether you're designing a remote therapeutic monitoring business or a new physical therapy clinic, or helping a Medicaid agency improve health equity or access to care. No one's going to stop you really anywhere. It's just, have you done enough research to say, yes, there is a there, and here's how we differentiate ourselves in that market.
You know, now that you've been in for almost 7 years by the time
Yeah,
this goes
yeah,
live, right?
yeah.
We're not that quick. It's not going live tomorrow. What are some learnings? Maybe pick one. Maybe one rose, one thorn, right? Like,
Okay.
what is one thing that what has been a happy surprise about consulting, and
Yeah.
one thorn maybe that you didn't expect that you've now seen.
Uh, so I'll go with the thorn first.
Yeah.
For me, the thorn is that in a large firm, you have to become externally someone you weren't. So, as a physical therapist, I can walk into a group of consultants at any level, and if I don't have something that they think I'm going to add to add value to what they're doing, then they don't really have much use for me.
Hmm.
But as a consultant who is a physical therapist, I can add value. And so I have to figure out, like, where in that consulting, what do I have that is different than someone else, or what do I have that's additive from someone else? And so, for myself, that just happened to be, I guess, being able to connect dots and being better at business development and an alignment of these of client needs and what we can deliver better than others, maybe. For other people, I have a friend that I hired to Deloitte as a physical therapist. Prior to coming to Deloitte, he went out and became what's called a certified Scrum Master. And there's a system out there called Agile methodologies for delivering software and solutions. And the Scrum Master is like the ringleader of the thing. They're the one that say, okay, you talk for 5 minutes, tell us what you're going to do, and then now your time's up. We're going on to the next person. And they set what are called these sprints. Every 2 weeks, we're going to work through this thing, and then we're going to follow up to see how it goes. So he did that. And now he became somebody that he wasn't really. He was a physical therapist, still is. But now, from consulting lens, he's a scrum master. And that's what then we can use him for. And then when you put him on a healthcare project, all of a sudden he's a scrum master that has a background in healthcare. So he can talk to our clients a little bit better than someone else. He can help them to understand that, yes, I've been there. I've treated like your end users treat, your clinicians treat your members, depending on where you are. That's what kind of makes a difference. So the thorn is, you think you can come in and you're fine and you've got it. The reality is, you kind of have to you have to learn something new, and that's hard, and not always that much fun in the beginning. The rose for me, and this isn't for everybody, is it's hard work. And the reason I say that's a rose is because I really like to be challenged. I like my brain to work differently every day. I like to come into one day and it's all about personnel, and the next day it's all about business development. The next day it's always all about client management. And every day is just kind of different. And for me, it eliminated a little bit of the monotony of physical therapy, which can be a lot the same every day. So I've really enjoyed that.
I Man, I would almost say those are both roses. Depending on how you look at it, right? Like, your
Yeah,
viewpoint
yeah.
is so important. I think that's another really valuable lesson here, is that you have to be comfortable being a PT second almost, right? Like,
Oh,
hey,
in a firm like mine, 100%.
but even in a smaller shop, right? No longer is it treatment, right? Like, you're helping them rev cycle first, right? Even the folks that have gone to
Hmm.
the rev cycle companies, right? Or doing some sort of rev cycle consulting, you are
Hmm.
still a PT second. Now that is a very valuable second
Yes.
where you're able to look at things and be able to say, "Oh, if you ask that provider to do that extra click, like we're gonna have some real issues. Like that's gonna be really, really problematic because of X, Y, and Z."
Yeah.
Right? You're able to lean on that past experience to be able to be more efficient, be more effective as a consultant and as an outside, objective view for those groups. But it's not PT first, rev cycle consultant second. It is rev
Yeah.
cycle consultant first, just to use that as a
Yeah.
simple example.
Totally. Totally agreed. And there a couple of thoughts have come off this. So one is that um, I'm not saying we're physicians, right? But physicians in general have been comfortable with doing this for many years. You see many physicians that are CEOs of businesses and firms that you know don't don't really deliver medicine. They're business managers, they're business owners, they're executives, they're someone, and medical doctors have done this quite regularly, and obviously way more than physical therapists. I still believe that I am the first and thus far only physical therapist to be promoted to the partner principal managing director level at Deloitte. And I wouldn't be surprised if I'm one of the first in the big four, Deloitte, Ernst & Young, PwC, and KPMG. Which goes to show it's not that I'm special, it's just I did it. Someone else has to, and someone else will, and others should. But then the second thing I was thinking of is I get reached out to regularly from young physical therapist professionals that have maybe been in practice 2, 3, 4 years and are looking to do something different. And that's great. And what I'll say is pivot the lens back on yourself and say, okay, so I've been practicing for, let's just say 3 years. And now I'm going to go into consulting. And I expect that I'm going to come into some healthcare company and I'm going to show that my expertise as a physical therapist is something they really need. And you're going to be talking to someone who's 50 years old, who's been in business for 30 years, who is an expert in their field, and they're supposed to quote unquote listen to you because you've been practicing for 3 years. Now you've done it 3 years longer than they have. Okay, so great, you've got an infinite more experience. However, you've been doing it for 3 years. And not that that's bad or wrong, but you have to recognize where your endpoint is based on your level. If you've been doing something for 10, 15, 20 years, yeah, you're going to be able to turn that around and say, look, I'm an expert in this. And that goes for anything you've done, whether it's physical therapy or product management or whatever it is. Like at some point you become an expert. Let's call it 10,000 hours. And now you've got to continue off of that. So it's just a funny thing that I see when I talk with people that are looking to get into this profession.
Thank you for listening to this episode. This would not be possible without the sponsorship of Sarah Health. Sarah is the relationship operating system for physical therapy practices, driving better patient outcomes, improved arrival rate, and improved financial margins. If you'd like to learn more, check them out at Sarah, S-A-R-A health.com, sarahhealth.com. And if you'd be interested in advertising with us and helping us produce even more great stories, please let us know at steven@sarahhealth.com. Now, back to the episode. You're bringing back a lot of good memories, right? For me, especially my core, I guess, project that I did over and over and over again was a lot of supply chain negotiation during M&A and divestiture events.
Oh yeah.
And so, yeah, the first project it was rough. I'm very grateful to have some amazing mentors and senior managers and partners that helped me quite a bit. But by the time like number 3 came around, like I've seen this before, right? And
Yeah.
so when we did the eBay and PayPal divestiture, like that was number 3 or 4 of that same project that I had done, and it was able to have that level of expertise and be able to say, yeah, no, like here's what SAP is probably going to do based on what I've seen like in these other negotiations. So like here's what we should expect. Here's the model. Here's how we're going to go about it. They're going to be one of the toughest to negotiate with. Let's just like know that ahead of time and to be able to have that expertise, which to your point, because I'd seen it 3 or 4 times, I'd seen it infinitely more times than the group I was working with who had seen it
Yeah.
zero, right?
Yes.
And
Yes.
they're like, I don't know. And I think that goes back to your rows on like it's hard work and it's challenging. And I believe, and probably am biased, right? No, not probably. I'm 100% biased, but it was that really hard work that was extremely challenging that allows you to learn at a pace that you may have never experienced before. And,
Hmm.
and so for the folks, again, speaking from my own experience, it sounds like you're echoing the same sentiment. If you want to learn at an absolute, just insane clip, consulting is a great place to do that at. Like if
Yeah.
you want
Yeah.
to be, and you can be comfortable with, hey, no longer are patients going to be walking in the door and you are going to be the expert every single day. It's going to be almost the exact opposite, right? You got to be comfortable
Hmm.
flipping it and be like, yeah, I don't know much. No, don't say that. Hey,
Fake it till you make it.
yeah, fake it till you make it. Don't be like, and I won't name it.
Yeah.
But in that same project, I was consultant at the time, reporting to a senior consultant, and he leads off the call and we, had built some good relationships, thank goodness. Leads off the
Yeah.
call, hey, it's day 10 at the firm, and I'm really excited to be able to get in. And I was just like, oh no, oh no,
Yeah. Yeah.
I'm about it. And I looked at him, I was like, man, I'm about to get a call from like our lead here. I'd imagine less than 5 minutes after this call gets over. He's like, no, no way, that's not what's going to happen. We're just waiting. Yeah, sure enough, like
Yeah.
3:30, boom. Here it comes to
Yeah.
walk him off the cliff. But
Yeah.
yeah, it's
Exactly. It is, it's the most challenging and then rewarding thing for me. I find it fun and tough all at the same time. It's great.
Oh, it's fantastic. Well, I want to transition into, and you mentioned you probably are, and based on what I've seen, I'd say you feel even more secure in the first PT to hit that PMD status
Yeah.
within the Big Four, um, and that's a heck of an achievement. That is an
Thank
absolute
you.
monster
Thank
achievement.
you.
Um, but I don't want to assume that it is your proudest one that you've made within your career. So I'd say what is that what is that moment or that achievement that you are really super proud of in your career to date, right? It's not over, so
Yeah. Yeah.
we can edit this in the future to have a
So
new one.
yeah, totally. Exactly. So professionally, um, I would say that the thing that I'm the most proud of is not the achievement of managing director, not the achievement of a win of a big project, or back when I worked as the chief clinical officer, of having a doctor or clinic do really well, or even as a PT, a patient, exceeding their goals and walking out pain free, whatever. Um, but it has occurred in the last few years, which is I made the conscious decision to put my entire effort into something. And I found that, I can almost become, and I don't mean to, I hope there's no hubris in this statement, but my potential is limitless. When you put all that you have and all your, kind of head down, I'm going to dig into something that has been fun, because I received the reward, the outcome of managing director or winning a project, but it was only because of the means that I took to get to those ends. That I am going to put it all in, and by putting it all in, I got something out. But that process was fun to do that, and that's what I'm most proud of. That I was able to put that kind of energy into something, mentally and physically, and have the outcome that we did.
And I will say, sounds like based on your experience and mine, consulting is a great place to do that. Like if
Yeah.
you want to take a big risk on yourself, it is a fantastic, fantastic place to do that because there's always going to be opportunity there. And if you can, to earlier point, make a business case and go for it, you're going to get a pretty long leash to be able to go and prove that, as well as a soft landing should it not work out the way that you thought. And we had
Yeah.
stuff that, I was lucky enough to be involved in that didn't quite go how we were
Yeah.
hoping. And
Yeah.
it's not the end, right? As
Yeah.
long as you can show good learning, at least my experience at Deloitte, and this is not meant to be a Deloitte commercial, but
No.
I had a great experience, right? Like,
Yeah.
but I knew what it was going into it. I knew it was going to be a lot of hard work, a lot of travel, which I saw as a pro, not as a con.
Yeah. Yep.
And you're going to get in rooms where you get absolutely grilled, and but then you have that muscle memory, and it's it's not scary. That next, or
Yeah.
as scary at least, that second, third, 52nd, 53rd
Yeah.
time. Um,
Yeah. I mean, I think between consulting and small business ownership, you can put in as much as you want to it, and it'll always take more. You want to put in 50 hours, you put in 50. You want to put in 90 hours, you put in 90. It doesn't matter. It'll always take it. There's always work to do. And so it's not so much do you need to work harder, but do you need to work smarter? And then sometimes it's you need to work harder. And I'm not saying you have to work 80 hours a week to make anything work, but if you want to, it'll take it. There's always more research to do. There's always more information that you can get out to clients or to your teams or whatever. Believe me, there's enough.
there's always one thing to research a little bit further, right? There's always
Yeah,
another way
100%.
to analyze something, another way to slice it, another way to go
Hmm.
into it.
Yeah.
Absolutely, 100%. And you know, as someone who has been there, exited, and I'm not saying there's a chance I won't come back one day, because I really did enjoy it. It is a heck of a lot of fun working with super smart people
Yeah.
all day, every day.
Yes.
That
We are
is,
fortunate.
oh, extremely,
Hmm.
right?
We
Like,
are we are very fortunate.
if you have not had the chance to work with some of the, especially the analysts and consultants, right?
Hmm.
That you now get to work with on a
Oh,
daily basis. It's
the,
incredible.
these young professionals walk circles around me and things, the way they think and the things they do. And I'm incredibly bullish on where we can go in our firm, and based on some of the quality of the people that I see that are at all levels of our firm.
Yeah, and man, a lot of really good pieces here, and I think hopefully at this point for folks that are listening that are even considering it, like, have a conversation, right? Reach
Yeah.
out. You know what? Let's give some tactical advice here, because
Okay.
I get this too. Um, if someone's going to reach out to you, right?
Yes.
And I have some ideas
Yes.
here, but again, I'm going to hold it. If someone reaches out to you, I would imagine hey, I'd like to learn more about consulting. Can we talk? Is like,
Yes.
oh man,
Yeah.
like yes, but also no. Like, we
Yeah.
can't. Um, how if you got to design a playbook, right, or a set of simple steps as
Hmm.
folks think about how to start networking within some consulting firms to learn more, which by the way, you have to do. Like,
Hmm.
you have to do it, right? Your
Hmm.
network is your net worth, is
Hmm.
not only applicable in broader life, but I think it's especially pertinent framework for consulting. So
Yes.
yeah, with if you give the keys to the kingdom, right? How would you advise folks that are looking to network in?
So I'm going to go, tactical and strategic in where we are. So very tactically, your resume cannot be a physical therapist CV. No one
Mhm.
in consulting cares that you know how to manage total knee arthroplasties. Okay. Or that you have, you know, treated this many people or that you've done these things in clinic. Like they don't know what to do with that. So in general, your CV, your resume has to, I like to say, if all applicants were apples, you can't look like a piece of bacon. It's still a food, you're still a human, but you're not the same. You have to do your level best to get your resume to look like an apple. And so when you think about things like, let's say you're in a small business, in your resume, you want it to talk about not that you're the clinic director, but that in this role, you have done human capital management of this many people, um, that you have done, that you have helped the revenue increases of 15% over the last 2 years, that you have stimulated a marketing and sales plan that has grown XYZ, something like that, because that means that you've got a skill that our clients often need help with. So your resume needs to read, your CV needs to read like you are someone more in the business world than in the clinical world. And they're going to see that you're a physical therapist. They're going to see that you have a doctorate in PT, that you've done these things and those things. But being a certified strength and conditioning specialist doesn't help you. I promise you, it doesn't help you in this world. I have it. I've never used it. It doesn't help me. Um, the second thing is that when you in order to more look like an Apple, you have to have something they need. So for example, I talked earlier about the guy who's a certified Scrum Master. That is something that we need in consulting. I have another physical therapist at Deloitte that we've hired who has an MBA, an executive MBA, and his MBA work was in business management, and he can talk a story that people understand. I've seen physical therapists that or anybody that have like coding background. Maybe they understand, SAS or SQL or Python, or they've started to dabble in cloud technologies, AWS or Google Cloud or something. These types of skill sets are things that you have to be able to have so they open the door. Otherwise, they're going to look and be like, okay, great, you're a physical therapist. I don't know what to do with you. I don't know how to parlay that physical therapy into consulting or into business. I would put that for almost any line, any profession that is outside of like the core physical therapy profession, if you're looking to make a leap anywhere in there. Um, and so very tactically, like that's the resume has to change, and then that strategic piece of you've got to get more in there, which means you have to put in some effort before you were to apply to come to something. You have to get some sort of certification, get an MBA, get something that is extra and different, so that different from physical therapy, but not different from the people that firms like Deloitte or other competitors of ours see on every resume every day.
I like that, and there's a couple ways that I think about that. Is show the projects, not your clinic metrics. Like, right, like, okay, that's fantastic that your clinic was doing 1,000 evals a month.
Yeah, yeah,
That's great, but I think I'd be more if I was hiring, right? If I'm a manager trying to staff my team, I see that I'm like, oh, okay, but like, did it have 1,200 before you got there? Like, I
yeah,
don't, to your
yeah,
point, I don't know what to do
yeah,
with that. But now if you say,
yes,
I learned enough SQL to pull our outcomes data to learn that we do really well at knees, and then I organized a sales and marketing program to directly target those referral sources and saw our referral source, like our referral volume increase by
mm-hmm.
15%. And that equated to X much extra margin, even if you're not exactly sure, like exactly what that number is, like even that thought process of saw a thing, did some additional research, implemented a change, saw this as a result, even if the result isn't great, like, hey, saw the result that was 1% improvement,
Mm-hmm.
and likely due to XYZ if I was to do it differently.
Yeah,
Like, all of that, I'm like, oh, I can work with that. That
yes,
makes a
love it.
ton of sense to me.
Totally love that. That's a perfect example for people to think about, um, because it's just gonna get you in that door, and that's the most important thing. We have to know what to do with you. I was fortunate enough, and I don't have any of that. I'm not a coder. I didn't know cloud technologies. I don't have an MBA. I don't even have a bachelor's degree. But what I had done through my career is I had been fortunate enough to been published 20 times in peer-reviewed journals and written book chapters and lectured around the world on physical therapy and business management. I was the chair of an institutional review board. Those things we're able to get pulled into some areas that we do at Deloitte to help Navy medicine and so on. So it like that was my hook, and that worked for me, but that took 15 years of work to get there. And if you have that, that can be your door opener, but by God, your resume needs to read that way.
I guess it's really important, and there's a little bit, especially for the younger crowd there, that's kind of between the tea leaves a little bit, which is take that extra project on. Like take
Mm-hmm.
that extra project on, right? Like, hey, my clinic's looking for somebody to uh, pilot this new marketing outreach program.
Yeah.
Take it and own it, right? Like if
Mm-hmm.
you do that and you have ownership of it and you can talk about it, it's just going to make that process way easier for you, and you can at least like short it's not even a shortcut, right?
No.
You're just like you're
Yeah.
just pushing work further upstream to get it done.
Mm-hmm.
But I think that's extremely valuable insight and advice to folks. And then I know from my experience running the campus recruiting team for a couple of years at Kansas State,
Mm-hmm.
as well as
Yeah.
being a part of the UCLA Anderson like MBA recruiting program. Like, get that gold star of a PMD referral on your application before you even send it off,
Yes.
right? Like,
Yes.
that is key. That is so key
Yeah.
because if I had to guess, I haven't even looked at the the I guess application process, but I'd bet if you went there today, there is a box for referred by or something like that. And
Yeah.
not that it has to be a PMD necessarily, or partner, principal,
Yeah.
manager, director. Sorry, the acronyms
No.
come
Yeah.
back like
Deloitte
things like
terms.
that,
Yes, they
right?
do. Yeah. Yeah.
It helps a heck of a lot.
It it does, and I'll tell you probably more impactfully what that you know partner, principal, and managing director is going to do is they're actually going to go behind the scenes to just at least tell someone, look, we I can't influence, like I can't hire someone that is, friend, family, or whatever. I can't, it's not a nepotism thing, but we're going to say, look, I've talked to Jane and she's phenomenal. And I think you should talk to her because I think she might be able to help us in this area. Done. Right. And it's that thing that happens. But I tell you, like, I can't do that personally. And the people I know at my level can't do that unless they know what to do with you.
And feel comfortable sticking your neck out a little bit, right? Like
Well, yeah.
you only have
Yeah.
so much leadership capital, right? That you can expend. And so like just make it easy on them. But it's just kind of funny. It's like as a PT, you make it so easy for your patients to be able to make a behavior change. Like take that same thought process of like, oh, how can I make this just stupid simple for someone to help me out, right? Like,
Hmm.
and if you
Yeah.
think of it that way, it's like, oh, okay, well, what are their next steps going to have to be? Oh, they're going to have to go talk to HR likely, or be a part of some sort of hiring group, even if it's just an email
Hmm.
or a call. And so if I can give them that person what they need to be able to make it that much simpler, then it kind of goes back to what we're talking, like the whole theme of this conversation around, it's something else first, PT second. It's a very
Yeah.
valuable piece, right?
Totally.
That very valuable perspective and skill set, and then show how you've done the things and also make it easy for someone to be able to be a champion.
Absolutely. Agreed. That's a nice summary.
Well, I've been writing
It's like you've done
feverishly.
this before.
So okay, my last question, and this is definitely my favorite one.
Okay.
If you had a magic wand
Yeah.
and could change one thing about PT, what would it be?
Oh gosh. Is the American Physical Therapy Association going to watch this? No, not against them. Nothing against them. Um, I actually think we are too spread. I think we have too many. We do not have the ability to define who we are as a profession very well because we are doing so many things. We are a little bit of something to everybody, right? So we do pediatrics, we do neuro, we do skilled nursing, we do inpatient hospital, we do sports medicine, orthopedics. I'm forgetting things, right? We do all these different areas, and it's great. It's wonderful that we do all these different things. But as a result, what physical therapists do in inpatient rehab, or sorry, just inpatient, just like major med surgical inpatient, right? Versus what a sports medicine physical therapist does are two worlds apart. Granted, you're still trying to improve movement, you're trying to get people back to their life. I get it. But what happens is we lose a little bit of who we are. In a hospital setting, we're almost a paraprofessional, right? The physician tells us what to do, and we do that thing. In an outpatient setting, we want to be that primary care, that direct access. We're going to be able to make the decision for musculoskeletal conditions, neuromusculoskeletal conditions, and we're going to, be able to refer when we need to. They're just too far. And so I think we actually need to bifurcate or cut. And I would actually, and this is my bias because I was in outpatient orthopedic sports and I'm a SCS. I would cut the most of the inpatient stuff. I think we've bled far over with occupational therapy. I think we can probably give some of that work to occupational therapy, whether it's pediatrics or some of the more inpatient skilled nursing, acute rehab work. And I think we can shift more toward the outpatient setting, more towards the advanced rehab setting, whether it be pediatrics, neuro, ortho, sports. I think we're just going to be better off as a profession because we'll be able to define who we are. And our biggest problem, in my mind, is that we are still trying to work out of this paraprofessional mold. We're still trying to define ourselves as the primary care clinician for neuromusculoskeletal conditions. We're still trying to get direct access and allow physicians and patients to say that we know what we're doing. We're still trying to get the patient out on the street that came to you and you told them what was wrong with them with their lower back, and you know that you can help them. And a week later, they call you and they say, yeah, I went to my physician and he said I needed to take a prednisone dose pack and rest for 2 weeks and I'd be better. But who won that? The physician, because the physician is still that head of healthcare delivery. And I think until we become more unique in what we do, I don't know that we're going to be able to make the kind of progress that we want to make in the time that we want to make that.
I really like that answer. I really like that answer.
Sorry for everybody on the other side that I love you. That's just what I would do.
Well, I think we see it all the time, right? Where we have customers that have PTs and OTs in the same clinic, right? And it does breed this, like, what are you? This lack of identity, right? And maybe if you told me, hey, that is a main driver of payment issues that we see,
Mm-hmm.
I would 100% believe it, right? Because, like, what are you paying for, right? It actually
Mm-hmm.
goes back to our earlier conversation around, like, hey, like, showing how, like, I can solve your problem. Well, you can do that at a personal level, and I think PTs are really good at doing it at a personal level. But at a professional, like, systemic level, what does PT do? Like, well, we can do every. It's like,
Mm-hmm.
whoa, like, that's
Mm-hmm.
I I got to have a better way to think about this. Whereas, like, okay, I'm Blue Cross Blue Shield and I pay an ortho to do, like, this ortho only does total knees and maybe a couple total
Mm-hmm.
hips, right? But, like, that's
Mm-hmm.
all she does is
Mm-hmm.
total knees. And I know that. And I know this ortho group specializes in this thing. Whereas if you have an outpatient PT department, or especially when I think of the groups we work with, in particular the physical FYZ ICL
Yeah.
franchise, like,
Mm-hmm.
holy cow, and they specialize in balance and in movement
Mm-hmm.
disorders, and
Yeah.
they do a fantastic job. The stories coming out of those clinics are amazing. But you could
Yeah.
all argue, like, hey, the groups that are doing that, as well as, helping a 15-year-old with their ACL recovery, like, it's hard for folks to, like, even be able to fully grasp, like, well, if you do everything, then what do I do if I have a specific issue? Right? Like,
Yeah.
and that's what people have, is specific issues that they want addressed. So yeah, it's almost this, like, if you do everything, you actually do nothing. And that can, I, I really like that answer, because I think it gets to the heart of the some of the core, maybe even the core issue, of why PT has trouble getting paid for the value they deliver. Because, like, well, what is that? Right? What is
Yeah.
that? It's like, well, it depends.
Yeah.
Like, well, it depends. Like, even as a consultant, like, we know that's
Yeah.
not a great answer, right? And it
Well, we're
typically
super
follows
good at
up.
saying that though.
Yeah. Yes.
Yeah, I
Yeah.
mean, there one of I got a book around Good to Great is somewhere around here.
Oh,
Um,
by Jim Collins. It's right
yeah,
there on my bookshelf. Yes.
yeah, down over there. But Good to Great, the hedgehog concept, right? Be best in the world at one thing, and I would say, when we're not there as a profession in physical therapy, and I don't know that I see a path that we will be when we're this broad, just as a profession. I'm not just talking about an individual business. I'm just talking the profession. And so you kind of have to choose, in my mind, as to what we're going to do. Um, I can't tell you how many times when I worked inpatient, which I did for a little while, and and I like would painstakingly document that I ambulated, with contact guard assist 250 feet. We rested 3 minutes. We did sit to stand transfers times 10, and then we ambulated 250 feet back with, contact guard assistance times two. Right, write that down, and then I come in the next morning, and the overnight nursing staff would say, "We walked to the cafeteria. We had an ice cream, and then we walked back, and then I put him in the chair." And I'm like, "What?" But see, but I said you couldn't walk farther than 250 feet, and so then it's kind of like, was that skilled? Was what I did skilled? If a certified nursing assistant came in and like just did their own thing that was different or better or more or whatever than what I did. And I think that's that difficult part. And so then you get the physician who's reading that and says, well, why are we doing the physical therapy that way when they're just walking it? And then that permeates into the rest of what they do, in where we sit as a profession. And I tell you what, I would put 90% of the outpatient orthopedic sports physical therapists as to be a better diagnoser than 90% of the physicians out there. Whether you're primary care, orthopedic surgery, truly, I don't care. I just think we're better at it, because I think we look at more than a picture, an MRI or an X-ray or whatever. We're just better at it, but we're not very good at being the person to diagnose. And then our diagnoses get kind of flubbed, because it's like, the person has some random thing as opposed to a medical diagnosis that no one understands outside of physical therapy. So I digress.
That you're And we just got done with private practice section, right? So,
Okay, yeah.
big conference, and had dinner with a clinic owner, and it's just resonated with me. And what he says, like, look, I I don't need 40 minutes to eval you. Like,
Yeah.
I can watch how you fill out your forms in the waiting room,
Hmm.
how you walked and sat down in the chair, how you waited, if you were in pain, if you squirt, like, I can see all that. And then I can see as you're walking back to me, like, I'm
Hmm.
95% of the way there within 10
Yeah.
minutes.
Yeah.
And I wonder if part of this is driven by what the system has in place, of like an eval equals 40 to 60 minutes. Like,
Hmm. Could be.
why? Why does it, what is
Could
it
be.
like, why does it have to be that way? And I know some of the things that we're doing as far as collecting data from the patient in between visits and then
Mm.
surfacing that in an AI generated summary, right? Like, what if your subjective portion is just done?
Hmm.
Like, it's done because the patient has chronologically logged the key data points that you want in between the visit. Like,
Hmm.
does it even need to be a 30-minute, a 40-minute, you name the time increment
Yeah.
above 10, right? Doesn't need to be that anymore. And like and this is me completely just shooting off the hip, but like, are the longer visits actually at a detriment to the profession? Um,
Well, I think unless there's a guy here that's in the DC area, that's charging $250 a session, right? That's not eval, that's a session. Um, I don't know, maybe he needs a longer visit because he's charging $250 cash. But I think if we're getting paid, $19.54 for manual therapy and, $17 for a reevaluation, gosh, that's hard to do for half an hour. It's hard to make any money, and actually demonstrate that level of value. But
yeah, you're entirely correct, and speaking from very naively, but like I would imagine that an ortho doing a consult doesn't need to spend 8 minutes on anything at a minimum. Just a guess. Just a
no,
guess.
they don't. They do. Yeah, you've been to them. You know that.
I have. Yeah, been to him for labrum repair,
Yeah,
and
yeah,
then
yeah, yeah,
ACL meniscus repair. So, as I
yeah.
said, frustrated patient, which is why I started the company.
But by the way, in my world, guess what code they're charging for that, and how much they're getting paid, and whether that service is actually justified at a high complexity. But I digress.
For a follow-up conversation. Uh, Dr. Barton, I just want to say thank
Oh,
you.
hey, thanks, Steven.
As a quick recap, and I'm probably going to miss a few things, but for those that are interested in going into consulting or at least exploring, I think you
Yeah,
gave multiple really good insights, but just tactically, like, how think of it from the terms of who you're talking to and have it be easy to be their champion. And
hmm
how that happens is, I think your analogy, the apples to bacon, is, and I know I'd pick the bacon, but like is really really good. In that if I'm gonna make an apple pie, saying your bacon isn't super help. Like I'm like
yeah,
I don't know. Like I'm not Gordon Ramsay. I don't know how I can make this
yeah,
all work, right? And so think of how to be at least an apple with a better shine to it, right?
yeah,
And think of it that way. Knowing that the networking and having someone who's going to put a gold star on your resume is incredibly important. But again, with the foundational understanding that I need to make it easy on them to do so. And before that, even just doing some of your own research around, okay, who do I want to serve as a client? Because that's going to be a major determinant of what part of the consulting industry that I target to. And I really like your answer to my favorite question, the magic wand. And yeah, there's this identity crisis that the profession is suffering from, and I think it's almost like this rot, right, that spreads and has all these other symptoms that pop up, but is potentially one of, if not the, like, core issue that needs to be solved. So I just want to say thank you very much for your
yeah.
time. I know how much it means for you to dedicate this much to the listeners, and I hope for the next time you get your inbox blown up, you could say, "Hey, watch this,"
Uh,
and get some high ROI
I
from
love
it,
it.
and gain some hours back while also delivering a lot of really good information to folks asynchronously. Wow, like who'd have guessed,
There you
right?
go. I love it.
You're delivering care asynchronously. So there you go.
I
It's
love it.
career care versus clinical. Uh,
Exactly, exactly. We need it. We all need it.
that we do. That we do.
Yeah.
Any parting words before I cut us off?
Thanks for what you're doing, Stephen. We we are more individually and as a profession, physical therapists, we are more than we think we are.
Hmm.
And if you look into yourself and if you examine, I guess, your potential and think about broadly what you can do, I just think the sky is limitless for all of us. And the more we get physical therapists out in different areas of the world, the better off our overall profession is going to be. The better The more people are going to think of us as being, I guess, a force to be reckoned with in the business world, in the consulting world, in hospital management, and whatever. But I think we do a pretty good job of limiting ourselves. I think we do a pretty good job of saying, this is what I know and this is what I'm good at, and that's it. And I would just encourage you to not.
Let's end on that. As a profession that, PT way more than you likely think you are, down to
Hmm.
the personal level. And if you want to be the change in the world, you need to open it up others' eyes and let them see it. So with that,
Absolutely.
I want to say thank you so much for being on,
Thanks, Stephen.
and
Thanks for having me.
look forward to next time.
Thank you.
Thank you for listening to another episode of The Disruptors. I hope that you were able to take one or two things away that you can apply immediately to your own innovation journey. As always, I'm your host, Stephen Cohen. This is sponsored by Sarah Health. Let's keep moving.